Welcome everyone to the Canadian Nurses Association's webinar series, Progress in Practice. This webinar is on national competencies for registered nurses in primary care, what you need to know. This session is being recorded for nurses who are unable to participate today. My name is Josette Roussel and I'm an executive advisor at the Canadian Nurses Association, and I will be hosting this webinar. At the end of the presentation, we will answer your questions, which you can bring up by hovering your mouse at the bottom of your screen and clicking on the Q&A button. We will address as many questions as time allows. The certificate of participation will be emailed to you along with the link to the recording of this webinar. And now a little bit about our presenters today, Julia Lukovics and Trina Clayson. Julia completed her PhD in nursing at Queen's University. Her program of research focuses on the integration and optimization of nursing within the primary care setting. She is the recipient of several awards, including the 2017 Council of Ontario University Program of Nursing Doctoral Dissertation Award. In 2018, she assumed position of President-elect for the Canadian Family Practice Nurses Association. In collaboration with the association, the Canadian Nurses Association, and an expert team of researchers, Julia led the development of national family practice nursing competencies. Trina Clayson is currently working on a doctorate of business from the University of Liverpool. Her thesis is focused on nursing leadership within the patient's medical home. Trina is a busy administrator of overseeing 42 family practice clinics with more than 75 nurses providing primary care. In 2018, she was elected president of the Canadian Family Practice Nurses Association. Trina sits on the CNA Network Advisory Committee and is one of the 2 elected network directors on the CNA Board of Directors. Trina is passionate about the work of nurses provide in primary care and has been privileged to be a member of the team who has developed national family practice nursing competencies. And I myself have been privileged to work with this team on the competencies. Over to you.
Thanks, Josette. So to begin with, as indicated in the promotional abstract for this webinar, the objectives of the presentation are to describe the current state of RNs in primary care across Canada. Can I get the next? Thank you. And 2, to understand the importance of competencies that reflect the unique practice of RNs in primary care. And finally, to apply competencies to support the professional practice of RNs in primary care across various settings, including practice, education, and policy. Julia?
Yes, sorry, I was on mute there. So before diving into the content of this presentation, I just wanted to take a moment to acknowledge the key individuals and organizations that contributed to the success of this project, including the Pan-Canadian team of expert researchers and knowledge users that represented different domains of nursing in the process, including research, education, clinical practice, policy, and administration. Could I have the next slide? I'd also like to acknowledge the funding support that was received to support the project activities. Funding was received through a CIHR project grant, as well as cash or in-kind contributions from the CFP&A, CNA, and CASN. Next slide. Most importantly, I wanted to thank the many individuals across Canada who participated in the Delphi panel survey process, which ultimately led to consensus on a final set of competencies for RNs in primary care. This project would not have been possible without the input and feedback from these key individuals.
So why focus on the registered nurse? Well, RNs are currently the most common nursing provider in primary care. We also had an explicit recommendation from several nursing organizations, including CNA and RNAO, to develop competencies for RNs. And RNs were the group that CFP&A was getting the greatest pressure from to do this work. Additionally, research has been conducted in similar areas, setting the foundation for the development of these competencies. And we also have been receiving expressed interest from other organizations to articulate the competencies for RNs in primary care. So we do recognize other nurses work there. We just needed a starting place. Next slide. The registered nurse in primary care is also known as a family practice nurse or a primary care nurse. These terms are used interchangeably both in academia and in practice. The term family practice nurse is used because it aligns with the national association that represents this group of nurses, namely the Canadian Family Practice Nurses Association. Next slide. So what is primary care? It's the entry point into the healthcare system. It focuses on delivery of health promotion, disease prevention, and management of episodic and chronic conditions across the lifespan. Within clinics or office settings, this may be found in a family health team, a community health center, a physician-owned clinic, or primary care networks. And as per our media, different options are happening on a regular basis. Next slide, please. The registered nurse in primary care is a key contributor within the primary care team across many jurisdictions in Canada. The registered nurse works in partnership with physicians, nurse practitioners, and other providers who are also part of the healthcare team. Family practice nurses or registered nurses in primary care function as generalists in diverse practice settings across the breadth of primary care services. A key item is that these nurses provide a broad range of health services. Next slide, please. We have produced an infographic, which we've shared, that talks about some of the specifics that registered nurses do in primary care, including health education, health promotion, chronic disease prevention and management, therapeutic interventions such as wound care and immunizations, medication management, pediatric and women's health, referral management, care coordination, and system navigation. Next slide, please. Community health nursing is a term which is used to describe nursing that supports the health and well-being of individuals, families, groups, communities, populations, and systems. Family practice nursing is a specialty area of nursing under this umbrella. Next slide, please.
So emerging literature is demonstrating the many benefits of competent family practice nurses in primary care, and this is creating a greater and stronger argument for the need to integrate this role into primary care teams. Thus far, research has demonstrated that RNs in primary care can assist with quality, access, and cost of care. RNs in primary care also help address the increasing complexity of patients and the prevalence of chronic diseases, which are both two pressing issues facing our healthcare system. They've also been demonstrated to improve physician satisfaction and patient satisfaction with care. Next slide. So where are we now with respect to registered nurses in primary care? Globally, they're increasingly being embedded within primary care teams. In Canada, team-based models of care that incorporate RNs are present across the country in varying degrees. For example, in Alberta, Nova Scotia, and Ontario, RNs form the core primary care teams. There's been deliberate efforts to implement registered nurses in these provinces. Other provinces have been slower at implementing this role, such as Newfoundland and Labrador and British Columbia. And one of the biggest barriers to integrating this role into primary care has been the fee-for-service funding system. Next slide. So information on family practice nursing is lacking in Canada, and it's contributing to their underutilization and missed opportunities to provide high quality patient care. Next slide. So as part of my program of research, I'm engaged in a variety of different research projects to help address some of these knowledge gaps. For family practice nurses, we need workforce data related to human resources to help with tracking, planning, and reporting of this role in primary care. We need a better understanding of the optimal roles in primary care, This is especially important with the emerging patient medical home model, which is also known as a health home model across the country, to ensure that the RN contribution is clearly articulated. We also need to continue to measure outcomes that reflect family practice nursing care, including cost effectiveness and outcomes that are sensitive to care delivered by RNs. And lastly, there was a need to define a national set of family practice nursing competencies. So absence of national competencies for RNs in primary care has been a fundamental challenge to the integration of this role in primary care teams. So what are competencies? You can see on the figure in the slide that they're sandwiched between standards and roles and activities. Competencies are defined as integrated knowledge, skills, judgment, and attributes required of a nurse to practice safely and ethically in a distinct role or setting, such as primary care. They define the scope and depth of practice, and they can be used as a framework for establishing baselines, measuring performance, and forming job descriptions. Competencies currently exist for other areas of community health nursing, such as home care and public health, but until this project, they were not available for registered nurses in primary care. So this is a figure that is within the newly updated revised standards of practice for community health nurses in Canada. And this is the framework that was applied for our competency development project. One of the key updates was the incorporation of family practice nurses into their standards document. So in this figure, the blue represents provincial regulatory standards, such as those established by the College of Nurses of Ontario or other provincial regulatory bodies. The yellow represents the community health nursing standards, defining specific expectations for nurses working in the community. And then the competencies, which are the knowledge, skills, and judgments needed to practice in a particular setting, which meet these standards, are represented by the three small overlapping circles. The home health, public health, and family practice competence sets are all derived from the standards and guide the practice of nurses in these areas of community health nursing. So as Trina previously mentioned, the development of competencies for registered nurses was an explicit recommendation made by the Canadian Nurses Association, the Registered Nurses Association of Ontario, and it was also within the CFP&A strategic plan. There are many benefits to having competencies for registered nurses in primary care, and they're all presented on this slide, including support to support the integration and optimization of registered nurses in primary care across Canada, to articulate the unique contributions of RNs who work in primary care settings. These competencies will help contribute to a competent national workforce of RNs who work in primary care. And they'll also serve as a tool for facilitating interprofessional team functioning by providing role clarity and articulating the scope of practice of registered nurses working in primary care. Competencies will support employers with recruitment and integration of RNs into primary care settings through the formation of job descriptions, credentialing mechanisms, interview guides, orientation materials, and other relevant tools. They'll serve as a framework for performance evaluation to aid employers, researchers, and other stakeholders to generate evidence on the contribution of RNs in primary care. And they'll also help guide nursing curricula across Canada regarding content related to RNs working in primary care, including undergraduate, certification, and postgraduate programs. So the road to competency development has been a long one. And for the next part of this presentation, I'm going to take you through the journey and the process that has been used to get to where we are today. So it really began in 2017 at a key stakeholder meeting that was held in Winnipeg, Manitoba, with funding through a public engagement grant from Memorial University, as well as some contributions from the CFP&A. This meeting brought together key stakeholders representing different domains of practice across Canada. Key outcomes from this meeting included the need for comprehensive and a systematic approach to competency development. It also resulted in strengthened partnerships between academics, administrators, researchers, clinicians, and knowledge users, and the establishment of the Pan-Canadian team that led this project. At the end of the meeting, there was a plan to secure funding, and an application for a CIHR project grant was submitted and was successfully received. So the purpose of the project was to develop competencies that reflect the unique contributions of RNs in primary care to support the integration and optimization of this role within primary care teams across Canada. Briefly, the methods that were used to develop these competencies included the initial draft of competencies, followed by a Delphi approach. So the initial draft was guided by an environmental scan of international literature related to family practice nursing, as well as a panel of key informants which met in person for a full day professionally facilitated workshop in Toronto, Ontario in December 2018. The first draft of competency statements underwent the Delphi process, which is a consensus process used to obtain national agreement. And this included 2 survey rounds to over 100 participants across Canada. So the final result and outcome of this project was the production of the competency report, which is available in English and in French. And this report will be posted shortly on the CFP&A website for viewing.
Okay, so the competencies for RNs in primary care are organized into 6 domains, including professionalism, clinical practice, communication, collaboration and partnership, quality assurance evaluation and research, and leadership, with the final result being 47 statements. Those 47 statements are divided up under these 6 domains as follows: 8 under professionalism, 17 under clinical practice, 5 under communication, 5 under collaboration and partnership, 7 under quality assurance evaluation and research, and 5 under leadership. And we'll just go through some examples under each domain on the next set of slides. So domain 1, professionalism, one of the statements includes advocate for nursing role optimization within interprofessional primary care practice. Under clinical practice, an example would be educate patients on resources and tools for self-management of their health and well-being. Domain 3, communication. An example is exchange knowledge amongst interprofessional team members to promote excellence in primary care practice. Domain 4, collaboration and partnership. Understand the roles and responsibilities of regulated and unregulated health workers involved in interprofessional primary care teams. Domain 5, quality assurance evaluation and research. Understand quality performance indicators for primary care practice. And finally, domain 6, leadership. An example is participate in coordination of the development and or implementation of primary care-based programs to support health promotion, disease prevention, and rehabilitation. And we'll just walk you through how these competencies might be used by frontline nurses, employers, policymakers, researchers, and educators. So starting with frontline nurses, we randomly pulled out domain 2, clinical practice, looking at 2.3, apply strategies for motivational interviewing, stages of change to support patient self-management. This indicates that the frontline nurse will need to ensure that he or she is abreast of the latest tools and strategies to support patient self-management. For employers, we pulled out domain 1.0, professionalism, statement 1.1, practice in accordance with evidence-informed guidelines and policies relevant to primary care, indicating that employers wishing to ensure family practice nursing competency will need to consider how to make best practice guidelines, licensing policies, and legislation accessible to the family practice nurse. For policymakers looking at quality assurance, evaluation, and research, we looked at statement 5.6, participate in gathering, interpreting, and/or synthesizing of patient data to inform continuous quality improvement. Policymakers will need to ensure family practice nurses are involved in determining continuous quality improvement systems and processes in their place of work. For researchers, we looked at quality assurance, evaluation, and research. Statement 5.5, engage in research, evaluation activities relevant to primary care and the nursing role in primary care practice with academic institutions, community services, and other professionals, indicating the need for partnership between all bodies to further family practice nursing competencies. Finally, we looked at educators and pulled out the domain communication. Statement 3.3, engage in respectful and supportive communication with members of the interprofessional primary care team. Educators will need to ensure interprofessional team communication is built into curriculum for nurses wishing to work in this area. So we've just given you a bit of a taste of the competencies. We're hoping that you will go on to the Canadian Family Practice Nurses Association website to get your copy. They'll be posted soon in both English and French.
So we also ask when reviewing the document that you send any comments or feedback or questions directly to me. There will be an email address on the website, and we'll start documenting and considering all this feedback and your comments for incorporation into the next updated and revised version. There are some next steps that we've received funding for, including 2 national surveys. So the first survey will look at the extent to which these competencies are integrated into undergraduate and postgraduate family practice nursing programs across Canada. This will generate an opportunity to identify areas potentially in community health nursing courses to better integrate these competencies and help prepare undergraduate nurses to work in a primary care setting. A second survey will be sent to family practice nurses working in family practice to identify their learning needs with respect to the competencies, as well as which competencies are being actualized. This will provide an opportunity to validate the competencies as well. We're also working on developing a few infographics targeted at different stakeholder groups, a journal publication which will outline the methods and results of the Delphi process in detail, and conference presentations, including an upcoming one at the 2020 CFPNA Biennial Conference in May, which will be held in Nova Scotia.
So CFPNA is a national voice for RNs working in primary care. We are a full network member and specialty interest group of the Canadian Nurses Association. Please consider membership with CFPNA as an opportunity to network with family practice nurses, enjoy the benefits of membership, support your professional association, and support work such as this that advances family practice nursing. You can find us on the website there. So in summary, the health needs of Canadians and ongoing reforms to strengthen primary care require an RN workforce that is well defined and understood within the healthcare system. There is a certification opportunity. Canadian Nurses Association plans to incorporate primary care nursing into the CNA Community Health Nursing Certification exam, and that update is in progress. These competencies will help inform organizations in actions targeted at the integration and optimization of RNs within primary care, and help shape the development of competencies for RNs in primary care internationally. Our goal is certification. We want to create a certification opportunity for RNs in primary care through the Canadian Nurses Association. Shows that?
Unmute me. Hello, I'm back. Thank you very much for your presentation on the competencies, and now we're gonna turn to the polling questions. We'll give participants a few minutes to complete the survey. Thank you for answering the poll. We have one question on the Q&A box that I'm going to ask both Trina or Julia to address. I completed a program from the Saskatchewan Institute, the SIAS, in 2003 in Advanced Certificate in Primary Care Nurse Practitioner. And would this be acknowledged as training? It was not recognized as nurse practitioner training when I came to Manitoba. So that's a question that I think it's not related to the primary care competencies. I'm going to answer that separately. Is Nova Scotia the only province where there's a family practice nursing program in the country? Julia, would you be able to answer that question?
Sure. So it currently is one of the only program, well, one of the few programs in the country. There was one offered at George Brown College, but I don't believe that it is currently active right now. And there's also at different universities, there's like, for example, the University of British Columbia has just developed in their School of Nursing the specific courses targeted at primary care nursing. So there are opportunities for professional development in primary care nursing. However, Nova Scotia has really taken the lead on education in this area.
Thank you, Julia. There's another question around when the competencies will be posted. When do you anticipate that someone wants to present the competencies and really showcase the great work that was done? So there's just a question about the timing. Do you think it might be before the holidays or after?
So it will certainly be before the holidays. We're hoping to have the reports posted today. We're just finalizing the reports at the moment. There was a few, we just need to check the reports. So you should expect them on the CFPNA website, hopefully today, tomorrow at the latest.
Thank you, Julia. I'm just going to give a few minutes for participants to, if you can post today, that's what that participant was asking, because she's presenting, if it's possible. She wants to use them in her meeting this evening.
Yes, thank you. That is our hope, to have them posted today.
Okay, yeah. That's great. And we also have on this line the email address of Julia and Trina if you have any questions around the competencies. Really appreciated the presentation, and this will be useful to many nurses who are trying to advance these roles. So thank you very much for your presentation, both Julia and Trina. There will be another set of webinars in the new year, and the first one will be on January 21st, same time at 12 to 1 Eastern time. It will be the revised 2019 Community Health Nursing Standards of Practice and what home health nurses need to know. So that's another interesting presentation, and I encourage you to register now, and we hope to see you in 2020. Thank you very much, and have a great day.
Thank you.